Hello everyone, welcome to Dr. Us Health Tips Weekly podcast. We all know that depression is a mental health disorder, but do you know depression is the most common mental health issue among older people? Depression is more than just feeling sad or blue, and it is not part of the normal aging process. Ever wonder how depression affects the elderly and what to look out for? Let's find out! We often hold a common preconception that only adults in the younger years fall prey into depression. Rarely do we associate depression with the elderly population. After all, they have already retired and there shouldn't be much in life to worry about, right? Well, the answer is no. In fact, many old people are at risk of developing mental disorders such as depression and anxiety, as well as neurological disorders like Alzheimer's and Parkinson's diseases. Furthermore, as people age, they are more likely to experience several conditions at the same time, some of which are physical illness such as diabetes, cancer, and osteoarthritis, while struggling with mental illness, depression at the same time. To make things worse, we often dismiss the classic symptoms of depression like persistent sadness and despair as the normal part of aging, when in reality, the elderly may need professional help more than ever. Let us emphasize that depression is not a part of the normal aging process. Everyone is different, and it's often a combination of factors that can contribute to a person developing depression. Study has found that elderly with the following characteristics are more likely to develop depression in their golden years. These include being female, being single, unmarried, widow, divorced, living alone or lack of social interaction with people, having a lower socio-economical status, having other medical conditions or comorbidities such as heart diseases, chronic pain, functional impairment, insomnia, or sleeping issues can further increase the risk of depression. Additionally, patients who have cognitive impairment such as dementia are at higher risk as well. Not only depression is common in elderly who already develop dementia, depression also increases the risk of developing dementia in elderly who did not have it yet. Other risk factors include genetics, depression during younger years, abnormal brain chemistry, and stress. Remember, depression is a real illness. It is not a sign of a person's weakness or a character flaw. You can't snap out of depression by asking them to stay positive. Most people who experience depression need professional help in order to get better. Unfortunately, depression in elderly is often undiagnosed and overlooked. A study that looked at 2005 older adults randomly selected from the Penang state government found that 19.2% of elderly suffered from severe depression. Another study that looked at 2,264 community-dwelling older adults in Malaysia found that 16.5% show depressive symptoms and the prevalence is higher in females. These numbers are not trivial. For every 10 elderly you meet, there is a chance that 1 to 2 of them have depression. The factors that contribute to depression in Malaysian elderly are fairly similar to what was mentioned just now, such as female sex, those who are unmarried, without formal educations, having income less than 300 ringgit per month, and those living in urban areas. It is natural to feel sad, down, and discouraged at certain times. Sadness and grief can be normal responses to life events that occur with aging. For example, the death of the loved one or transitioning from an independent life to assisted care. With a period of adjustment and support, they often can regain their emotional balance without falling into depression. With that being said, there is a huge difference between normal sadness and depression. Unlike sadness, depression can leave a person struggling to get through their day. If you or the elderly you know have several of these symptoms for more than 2 weeks, depression may be suspected. Here are some of the common symptoms of depression. Includes feeling sad and low for most of the days, nearly every day, with signs of hopelessness and wordlessness, having irritability, restlessness, or having trouble sitting still, loss of interest in activities that they used to enjoy, tiredness and low energy such as moving or talking more slowly, difficulty in concentrating or making decisions, having difficulty in falling asleep or oversleeping, eating more or less than usual, usually with unplanned weight gain or loss. In severe cases, the person may even have thoughts of suicide or attempt suicide. Depression in older adults may be difficult to recognize because they may show different symptoms than younger people. For some older adults with depression, sadness is not their main symptom. They may have other less obvious symptoms of depression, or they may not be even willing to talk about their feelings due to stigma surrounding depression. In other cases, they may seek help for less typical depressive symptoms that might initially suggest other types of medical problems, such as heart palpitations, restlessness, fatigue, tremors, body pains, shortness of breath, and fainting. If you or any elderly may have depression, make sure to seek help by consulting a healthcare professional that you trust. If high treatment cost is a concern, the elderly may visit a doctor at any government hospital and facility first. If necessary, the doctor would refer the elderly to receive psychiatric care at the government's Mentari facility. Seeing a psychologist or psychiatrist is often not enough. To address depression in elderly, they need well-rounded healthcare and strong community support. Mental health problems in elderly often coexist with physical illnesses that are something unbearable. Both mental and physical health issues in elderly should be handled with adequate medical treatment and, most importantly, to support and care from the caregivers and family. If you are not an elderly, you can help by raising awareness about depression in elderly and try to spend more time with the older adults in your household. They may have lesser years left than you, but they deserve to live healthily, happily, and with dignity too. Depression should not be the last chapter of anyone's life. That's it for this week's episode. If you have any questions related to depression, you can consult our professional doctors and healthcare professionals on DocToUs. DocToUs is a mobile application that allows you to talk to a doctor or any healthcare professionals via text chat at any time and from anywhere. For better communication, you can even send our online doctor images or voice messages related to your medical inquiry. You can now download DocToUs app on Apple App Store, Google Play Store, and Huawei App Gallery, or use our web chat at web.doctous.com. Take care, and we'll talk to you in the next episode.